Hello, my name is Daniel Trujillo, and today I'm going to be comparing and contrasting Medicare and Medicaid for COH 100. And before I get started, I'm going to dive into what each specific plan consists of and who's eligible for each plan. Starting off with Medicare, Medicare is a national level program that provides health coverage for people over the age of 65 or older, or people under 65 with certain disabilities, or anyone with ESRD. Coverage for this plan has separate parts to it, to be specific, and typically most people have parts A and B. These consist of hospital and medical insurance. This involves things such as inpatient hospital care, nursing, doctor visits, and medical equipment, x-ray screenings, things like that are all covered under those first two plans. And Part C is a kind of bundle deal that puts the two together into a cheaper price for people. So if you know you'll need both of these at any point, you have both plans to cover at a cheaper rate rather than paying for one and the other individually. And Part D is also one that covers prescription drug benefits, and it helps pay or offset the cost, better to say, for name brand and generic drugs, so people can have to pay less out of pocket. And Medicaid, on the other hand, is a more state level plan, but it receives both federal and state funding. And it's important to note that each state has its own specific Medicaid plan, eligibility, and payment rates. Medicaid provides coverage for low-income adults, people with disabilities, pregnant individuals, and children through their CHIP plan. One of the things I found most interesting on the MLN fact sheet was that Medicaid actually pays for over 40% of all births in the United States, which I found interesting, and I didn't know that before, so I found that to be really interesting, since obviously birth is a very expensive process. And the state that I chose to dive into for my comparing and contrasting is Indiana, since I do plan on being here for the foreseeable future, and so I obviously just want to learn a little bit more about what each plan entails here in Indiana. So starting off with Medicare, the eligibility for Medicare in Indiana is anyone who is 65 or older. They are eligible for a Part A plan based on their employment or a spouse's employment. Part B can also be added for a monthly premium, and the cost of this monthly premium depends on the amount of Social Security credits that you as an individual have. And you gain these Social Security credits through being employed for a certain amount of years. And each year, I believe you gain about 4 Social Security credit points. And so monthly premiums for this Medicare can range from free to up to $518 a month, depending on how many Social Security credits you have. And Part D can also be added as a separate monthly premium fee as well to cover drug costs. For Medicaid in Indiana, eligibility is based on the varying income that you have in a family and how many people are in the household of that family. This plan also covers pregnant individuals, children, and people with disabilities, and adults of all ages. So starting off, there are separate plans for these different categories of people. So children under 19, for example, and pregnant women are eligible for the Hoosier HealthWise, and adults ages 19 to 64 are eligible for what's called the Healthy Indiana Plan, and adults 65 and older are eligible for the traditional Medicaid, or they can choose Hoosier Care Connect as well. They have the option to choose between the two. So just to kind of close it off, I was really interested looking at the Ballotpedia about how national level plans like things like the Affordable Care Act, for example, are influenced by demographics, employment rates, and even like lawsuits through court systems. Things like that are constantly changing the affordability of these plans. And I found that interesting, since I always assumed they were like a set price, and I wasn't really aware of how many factors really went into the premium costs for these different plans. And it was really surprising for me to find out, since obviously I do plan on being in Indiana in the long term, so I'm curious. Obviously the costs are continually rising throughout the years that we've seen in the readings from 2012 going to now, it's been pretty consistently going up. So I'm curious to see how that is going to play into my future if I'm planning on staying here in Indiana. And another thing that interested me was that the average monthly premium for individuals for Medicare plan, for example, is about like $19. But in Indiana alone, there's probably 1.3 million around there people that are in under this plan. So it's obviously a very big process, and that price is constantly changing depending on the person. And I found this a really insightful to go through and learn about, since this is obviously something that applies to everybody. And just found it like a really interesting thing to talk about for sure. Thank you.